Chair, and to Ranking Member Murray for convening this hearing. Thank you to all of our witnesses today for really important and meaningful testimony. And I want to start my questions with following up where Senator Cassidy was on surprise medical bills. I have a bill as well, which is actually in Help Committee, and my senior senator from New Hampshire has another bill on this issue for dealing with the individual market and the uninsured. So I think there's a lot of bipartisan interest here. It's something we hear about from our constituents all the time. Studies have shown that nearly 1 in 5 emergency room visits involves care from providers who are out of network, and non-emergency situations often result in surprise medical bills as well. These situations aren't the patient's fault, obviously. You don't know who's even reading your x-ray, for example, and it's fundamentally unfair to hold patients accountable for bills that they have no control over. So that's one of the reasons I introduced the No More Surprise Medical Bills Act of 2018. And my bill focuses on the parts of the large employer market that states can't regulate. And it would stop surprise medical bills, and it would establish an independent dispute resolution process based on baseball-style or final offer arbitration models to incentivize reasonable payments and resolve payment disputes between plans and providers without putting patients in the middle. I know that we have work going on both sides of the aisle on this, but Executive Constantine, I wanted to start with you on this. How are you and your partners in King County working together to come up with innovative solutions to protect patients from surprise bills and hold down healthcare costs?
Thank you, Senator. King County works with our healthcare plans and employees to increase transparency, as we've talked about this morning, in cost delivery so that our employees can make informed decisions about their healthcare needs. But surprise billing is an area where patients have made an educated choice. Right. They've made a responsible choice to opt for an in-network provider only to find out after the fact that for whatever reason the provider changed. Yeah. And as health plans work to more tightly coordinate care and manage costs, as with the new plan that I described for King County, this is only going to be a greater challenge. Unfortunately, there's not that much we can do, either as an employer or as a government, to protect our workers from this challenge. There has been legislation in the Washington State Legislature to try to do what sounds very much like your bill. Yep. And I think it's absolutely critical that we stop surprise billing by holding the patient harmless and requiring those who are in a better position to understand who is to pay for what, who is covered and who's not, to take the responsibility. And I'm not an expert on which dispute resolution process should be used, but I do think that this is something that needs to happen at the national level and not just on a state-by-state basis. I strongly support the intent of your bill. Everyone agrees consumers should not be caught in the middle of these billing disputes, and as an employer, I feel particular responsibility to our employee family to make sure that they're not getting stuck with a large, unexpected medical bill.
Yeah, I talked to one of my constituents, literally went in for a cut on his finger to the emergency room. There was no other option. It was a Saturday night, so he needed to go to the emergency room to get it taken care of. It was an in-network hospital. He ended up with a bill for $3,500, and he was able to negotiate it down to $1,200, all for really a cleaning off of the finger, and I don't even think stitches were involved. So I would appreciate continuing to work with all of you on that. And Mr. Mars, I appreciated your testimony about all the work that you all try to do to make sure that your patients aren't getting hit with these surprise bills. But I did want to move on to one more topic, which is one that Senator Baldwin was talking about. New Hampshire also has an all-claims database, and actually, I'll give a shout out to my state. We were the first ones in the country to do it. And so we've been a leader in a lot of work related to promoting better value in healthcare. And we have, for state employees, something called Vital's Smart Shopper Program. It offers financial incentives to employees to choose low-cost, quality options for their care. But I think to a point you were making, Mr. Mars, and I just want to quickly get anybody else on the panel who wants to speak to it. For us, the critical thing has been to help patients understand that just because care is low cost or lower cost doesn't mean it's lower quality. And how do we really help patients understand, and how can we have transparency in outcomes as well as cost? So I'll start with anybody who wants to answer that. Go ahead, Ms. DeMars.
Happy to jump in. Yeah, it is an education process, and I think that being able to show employees data in ways that are digestible, easy to understand and use about cost and quality, and how those two things aren't correlated. High cost doesn't mean high quality, has been impactful. I also think that as consumers increasingly have high deductible health plans, that is making a difference.
Right.
We have people's attention when they're paying the first $5,000 of their care.
Yeah.
And we've found a willingness to take a look at and respond to information, even more powerful if there's quality information to accompany the cost information.
Well, I thank you, and I see I'm over, Mr. Chair. I will invite the other witnesses to comment in writing as a follow-up. Thank you so much.
Thank you, Senator Hassan. We have